Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Jill Carnahan, duly board certified in family medicine and integrative holistic medicine. Dr. Carnahan is a 14-year survivor of breast cancer and Crohn's disease and is passionate about teaching patients how to live well and thrive in the midst of complex chronic illness. She is also committed to teaching other physicians how to address the underlying cause of illness rather than just treating the symptoms. Thank you so much, Dr. Carnahan, for joining us today.
Thank you.
So, let's go back to your youth, and which was only a few years ago, I know. What initially motivated you to study medicine?
I always knew I wanted to help people. I knew that I wanted to find a way to really touch people's lives, and I always wanted to reverse disease. I didn't really know how at that time, so I knew nutrition and wellness was important, and I grew up in a household that put a premium on eating well and taking care of yourself. And then I found functional medicine, and I realized that's what I'd been looking for. So really looking for root cause instead of just treating disease with drugs and surgery. But I really felt like going the conventional route with education was still the best way. I wanted to get a great conventional education and then add to it so that my toolbox was a little bit bigger than just conventional medicine. So I studied nutrition and wellness in college, and I did a bioengineering degree just to learn a little bit more about biology and have a little bit of an edge on math and science and everything. But I knew I didn't really want to work in the industry or be in a lab. I wanted to work with people. And I think I came across functional medicine during my last year of undergraduate. And I knew once I read it and knew what they were standing for, it was like everything I'd been looking for, kind of trying to find the root cause. I actually applied to traditional Chinese medical school, osteopathic school, chiropractic school. I put my swath out there very widely to see what would transpire. And when I got accepted to several medical schools, I thought that's when I decided, this would be the best route to really learn great conventional medicine and then go from there and add on nutrition and wellness and functional medicine. And I think I had first heard, like I said, in my last year of undergrad about what functional medicine was. And so I was very excited to pursue that. And I continued to learn and do other things during my medical school education with the holistic medicine, different trainings and programs and lots of books and everything I could get my hands on during that time. So I just basically added on to my conventional education with those things that I was interested in, especially nutrition.
It's incredible that you found the time to be able to do that, knowing how rigorous the curriculum is.
So I went to Loyola Medical School to follow my dream of becoming a doctor, and it was amazing. And I found incredible friends there. We were in Chicago. And then suddenly, when I was 25 years old in my third year of medical school, things took a turn. And I first was in a surgical rotation. I found a lump in my breast, and I didn't really think anything of it. I mean, 25-year-olds, we think we're invincible. But on the insistence of close friends and my husband, I got it checked out. And very shortly found out that I had invasive, aggressive breast cancer. I remember sitting with the radiologist, and of course he was a colleague and teacher, and I remember sitting and looking over him, and I asked him if I could read the films with him, as most students do, and he looked at me and he said, Jill, if you were 55 years old, this is very, very suspicious for cancer. But you're 25, let's get a biopsy, let's see. But I knew at that point this was not normal, and I was definitely concerned. And shortly thereafter, I had a biopsy, and again, it was a colleague and a friend and a teacher who called me 2 days later, and her voice was cracking. I remember hearing her so clearly on the phone, Jill, I don't know how to tell you this, but you have very aggressive breast cancer, and this is going to be the battle of your life. And I didn't know if I had 6 months or 6 years, or I had no idea at that time. And so, as I do with everything, I took it on with all my heart, and I was bound and determined to beat this. And what I did at that time was, because it was so aggressive and I was only 25, and this disease is a totally different disease in young women compared to older women. What happens in younger women is it's a much more aggressive, life-threatening disease. I was in Chicago at the time of the diagnosis, and I was meeting with a group of young women under 40 with the diagnosis, and I remember that group really well, got close to a lot of them, because as young women we deal with a lot of different things than 60, 70-year-old women deal with. And I am the only one still living from that group. None of them survived. So I am literally a miracle, the fact that I beat this and survived. And I went at it with very aggressive conventional 3-drug chemotherapy. And then I followed that by radiation. And throughout the process, I had multiple surgeries. I was fortunate. I overcame it and came out the other side. I was very sick. I was bald. I was completely hairless after all the chemotherapy and radiation, and very thin, very malnourished, very tired, but I beat it. And I took a leave of absence during that year from medical school just to pursue the treatment. And I really just gave it all my heart and soul. And I also saw a naturopath, and I did a lot of nutritional interventions. So the beautiful thing was, even though I was pursuing a very conventional therapy for the breast cancer, I also learned so much about nutrition and supplements and gut health during that time. And after I finished treatment in 2002, I was 26, just turned 26, and I was considered cured. If only that was the end of my story. So I got through that. Again, I was sick, but I went back to school and I continued, and I knew I was tired. I knew I wasn't quite myself, but after that intensive regimen, you kind of expect that it's just going to be that way. And I started having cyclical fevers. So every night on my shift, I would get a fever, 101, 102. I mean, I was like massively flu-like and sick. I just worked through it. I didn't know any better. Started having abdominal pain, more weight loss, diarrhea. And eventually, I knew something wasn't quite right. I couldn't ignore it any longer. And this was about 6 months after I'd finished complete treatment for breast cancer. So eventually met with a gastroenterologist and got a scope, and I found out I had Crohn's disease. So another life-threatening diagnosis, number 2. I just beat cancer, and now I was facing Crohn's. And for people who don't know, most of your listeners know, but Crohn's is an autoimmune disease that attacks the gut lining. It's life-threatening, just like cancer. And I was really sick at that time. I also didn't know if I was going to make it out of that. My gastroenterologist said, Jill, this is Crohn's. This is incurable. This is going to require lifelong immune modulating drugs. And it's also going to require surgery at some time. You're not going to ever get away from this. And something inside of me, that passion and drive, was like, no, I don't believe you. And I remember him looking at me and saying, I asked him about diet, because of course I'm all about food, and food is medicine. And I said, can I change my diet and do anything? He said, Jill, diet has nothing to do with this. And again, in my heart, I knew, I didn't know a lot. I was still just finishing my 3rd year of medical school. I knew basics, and I knew my intuition, and my intuition said that's not true. And I was bound and determined to prove him wrong. So I fired him. And then I went out looking for answers and scoured the research, and I ended up coming across Elaine Gottschall's specific carbohydrate diet. I implemented that, and within 2 weeks I was symptom-free.
Oh my goodness.
So that was a start, and of course I wasn't cured in 2 weeks, but I kind of started going into remission. And over the next several years I learned about the gut and about the microbiome and about all these factors that contribute to autoimmune inflammation and Crohn's disease. And I have completely restored my health, and no more cancer and no more Crohn's. And I am more passionate than anyone about autoimmune disease and about the gut and about teaching with you here at A4M, because this is so profoundly changing lives, not only of myself but of our patients.
So how did you go through the remainder of your traditional education, knowing that the doctors that were essentially teaching you, that were taking care of you, had misguided you as well? So, and didn't have the same belief system, so to speak, as you did. So how were you able to finish up your traditional education?
What an insightful question, because really there's so much in conventional medicine that I don't agree with. And what I try to do is say, okay, the foundation here is good. There's wonderful science. There's wonderful things that have saved lives. What can I take that's valuable? And what can I ignore that's not valuable, such as drugs to treat autoimmune disease or suppress the immune system instead of getting to the root cause? And so as I learned in my own journey, I tried to take the valuable stuff. And more important than anything, I think, was seeing the models of the physicians that I wanted to emulate. I remember in my own journey, I had a radiologist that treated me with a special type of brachytherapy for radiation, so it was a very cutting-edge treatment. It was interesting because he had a study protocol, and it was average 50, 60-year-old women, and they were very low risk. And I literally begged him. I said, can you please, I don't want the radiation to hit my heart, and your type of radiation will save my heart. And I said, will you please take me on in your study? Wow. And I literally remember him with tears in his eyes. I was going to mess up his study because I was high risk. I was young. I didn't fit any of the criteria. And I literally begged him to take me on, and he did. He stayed that whole weekend to treat me. And my husband was there with me at the time. And I just remember seeing that compassion and that model of someone who would go outside the bounds of what was in the protocol or in the study in order to help me and to literally save my life. And I thought, I want to be like Dr. Kusky. I want to be like him. I want to be that type of person that goes the extra mile as a physician and does the right thing regardless of protocol or study. And then I saw other docs that were cruel and mean and heartless and looked at numbers. And so seeing that was probably the biggest part of the education in wanting to emulate that compassion and kindness and the fact that they would do anything for the patient.
So fast forward to you going into practice. Mm-hmm. And how have you taken this extraordinary gift that you were given of life, and how have you translated that?
Yeah, and it really is a gift, because every day that I'm alive, I remember at the time when you're in your 20s, you think you're invincible, and so you don't see mortality as an endpoint. And that definitely came face to face with that. And so it started to be realized every single day, every breath is a gift. And what I learned so profoundly was suffering and illness can be devastating, and it can change relationships and lives and be the most awful thing that ever happens, or you can use it to transform and catapult yourself into a whole different area. And for me, it was definitely the latter, in the sense of I had this newfound passion, and I had life that I wasn't expecting to have. And so it was all about, like, how can I use this to motivate and encourage and use it to transform lives. So I got out of residency. I was in Peoria, Illinois, and I went to the hospital director and I said, I am passionate about integrative and functional medicine. You don't have it here. I would like to help you. Can I start an integrative medical center? And fortunately, the CEO was excited, and it was something unique. So he hired me to do part-time family medicine and then part-time create an integrative medical center. So I was a medical director, hired on right out of residency, and I remember sitting down with the architects and the planners and like building the clinic from the ground up. And I'm very proud of that and excited that we were able to do that, because what I wanted to put into that was when people walk in the door, I want them to feel love and hope. And so literally everything about the clinic, from the decor, the colors, everything about it was very non-medical, very non-threatening, and had this ambience of really caring for people. And believe it or not, I think the brick and mortar, you can actually do that. So I loved that we created that. It was a beautiful building, and I worked there for probably 5 years before I left for Boulder, but it was a great experience. The downside was the hospital still looks at number of beds filled, and so there was definitely a pressure to see more, do more, and to fill hospital beds. And as a functional integrative physician, my goal was to keep people out of the hospital. So I started to see our paths were a little divergent, and it was a great start, and it was just wonderful for training. But at the end of 2010, I decided to leave that practice and start over, and I moved to Colorado at that time.
So you're in private practice?
In Illinois, I was employed, and now I'm in private practice.
So what kind of patients do you see?
Yeah. So I moved out, started completely over. I worked with Dr. Robert Roundtree for my first few years out there. He was so kind and generous to lend me space and collaborate. And boy, if any physicians are on the fence or not sure, I would so encourage them to step out and do your thing. If you're passionate about this, there's just no other better way to go. You create your own hours, you can really take care of people, you can spend more time with people. And I did that. So I basically lived my dream and recreated. And it started slow. And initially, I still am a functional medicine consultant. So I see now I end up seeing very complex, chronic, difficult cases that have been everywhere else and don't have answers. But starting out, I saw, gut issues, IBS, hormone balance, menopause, thyroid conditions, autoimmune diseases, pretty much everything. And then it's graduated to more difficult cases as I've gone, which I love.
Wow. What a story. What a story. It's unbelievable. So how have you implemented all of this history and knowledge and all of the new modalities that are out there. How have you implemented that into not just your practice, but your personal life?
Well, it's so almost predictive of what was going to come in my life. I remember as a high school senior, you write yearbook sayings and what's important to you, and I had my saying was, live as if you were going to die tomorrow and learn as if you were going to live forever. I know, right? Like, it literally almost brings tears to my eyes even now, because I had no idea what would come in my life. And at that time, 6 years later, with cancer and all that. But even now, to me, that's such a profound, I want to live every day so that I have no regrets and that I love people well. And I think one of the things that has made the biggest difference in my impact in the clinic and my staff and in my little world is the desire to really love people well. And people sense that and they feel that, and I think that's the difference in even the healing outcomes.
I'm all choked up by you. I'm sorry.
Okay. So I just think that loving people is so profoundly healing. I mean, so many people don't have that, and to know that someone truly cares. And literally, I tell my staff, if you get no other work done today and you love people, you have done your job. And so everybody owns it. It's not just me. I mean, they are an extension of me, and they love people so well. And I am so blessed because I have a beautiful, beautiful staff that I consider my sisters and mothers and daughters, just like this beautiful family. And I think that right there is this thing that's not teachable. I love the science. I love the functional medicine. I love the gut. I love the immune system. All that can be taught, but that loving people is really at the core of what makes the difference, I think.
So other than the success of your own personal journey and how you really treated yourself, do you have any great success stories that you can share from some of your patients? Well, my patients become friends, and I love them like if they were my family. And I have so many I could talk about. One in particular is just a beautiful lady that I met maybe 4 or 5 years ago with MS, and I remember she came in with a wheelchair and was not very mobile. And through treating the gut, treating autoimmune disease, treating environmental triggers, and bit by bit, it's been about 4 years, she sometimes uses her cane, sometimes comes in without her cane, but she is doing phenomenal. And like I said, I consider her a friend. She's a patient, but it's just such a beautiful thing to see something like that that's like my Crohn's, considered irreversible and permanent, and to see this change. And the beautiful thing is she is passionate about functional medicine too, so she tells her neighbors and she cooks for people and she does all kinds of things to share what she's learned to other people's lives as well. And is she taking traditional medicine?
No, she's not. Within 6 months of seeing me, she got off her traditional medicine on her own. A little nervous, but it worked out all okay. And she is on only nutritional supplements and diets. That's it.
That's incredible.
Yeah.
So what advice would you give? I know you said that, physicians, when they're getting out of practice or getting out of school, whatnot, if they're teetering with the idea of going this route, what advice would you give to them that had been practicing traditional conventional medicine, but are starting to get frustrated with the pill for every ill philosophy or the bureaucracy of
it's such a great question, because so many people are disenfranchised with medicine as it is now, and I was there for a while, and I was as well. Unfortunately, I got out very quickly, and it is so scary. No one gives us permission to step out and to take a risk, and these are big risks. These are financial risks. They're all kinds of ways they're risky. But the risk is so worth the reward. And I would just tell that people who are listening, if they're unsure or they're kind of thinking about it, go and learn, get reignited, get your passion back on, and then step out. Some people may need to work in an ER temporarily or keep their other practice open as they step out and do something different. There can be a transition. It doesn't have to be all or nothing, but do it. Don't delay, and take the education with A4M, because this is going to give you the foundation. And something that I remember from way back when is I love to learn, and I would encourage your listeners to continue learning, and that passion will drive the new innovations and all the things that we do. But more important than that is just that courage to step out and do this, because it is scary, it is risky. The rewards will be worth it 100-fold. Yeah.
So when you're acting as a faculty member here at A4M and you're teaching, what would be, you think, the single most important message that you would deliver to a room full of your constituents?
Oh, that's such a good question. just to step out and start trying. What happens is, I remember when I first started, you never feel confident. So you never feel like you know it all. Even now, I've been doing this 15 years, which in functional medicine is quite a long time. But I still have cases where are difficult or I don't always have the answers, but I keep moving forward. And especially someone new or someone I'm teaching, I would say start testing, start using this, start intervening, because all of a sudden what you're going to see miracles. You're going to see things you never expected. And you'll be like, oh, I did that? Wow. I mean, I remember the first few times I tried some of these interventions and I'd be shocked the patient came back better. But you know then, oh, this stuff really works. So if they're on the fence or if they're just learning or just starting out, step in, try some testing, start on yourself, because that's always a fertile ground for healing. And the more we learn about ourselves, the more we can pass it on to other people.
So, do you have a mentor?
Oh, gosh, I have so many. Bob Roundtree was an incredible mentor, kind and patient, and partner for a while in Boulder. You know what's interesting is we always think about people who are maybe more established in the field or have been doing this longer or more knowledgeable, and certainly I have so many of those, but I'll tell you, whenever I come to one of these things to teach, I learn from the audience. And I love going into it with, we can all teach each other something, and there's no ego, there's no position. It's like, for me, I get just as much out of teaching as I do out of if I were sitting in the audience. So I feel like all of us can mentor one another in that realm. Yeah, and you know, relationships are so important to this. At least for me, sometimes I think I can go at it alone. I'm like this lone ranger. But I really feel like whether it's family or friends or spouses or partners, those relationships are so critical. And I don't know about all the rest of the listeners, but I know I tend to overwork and be a little bit of a workaholic. And I think finding that balance between making sure you have time for family and friends and balance and going hiking in the mountains or skiing or whatever you enjoy doing, those things make us more well-rounded and keep us healthier. So doing all that we love, but also trying to find balance, I think is an ever moving target for physicians, and I just encourage myself included, and myself first, to continue to seek that balance in relationships and people outside of medicine as well.
So do you have any hobbies, or how do you fill your time when you're not practicing or teaching?
Yeah, I love to hike and ski and be outdoors. For me, nature is one of the most healing environments. So hiking up Sanitas in Boulder, or being at Winter Park or Breckenridge skiing in the winter, anything outdoors. And in April, I bought a motorcycle, so getting on my BMW is amazing. It surprises people, but I love it.
Well, considering where you've been, and then you put yourself on a top of a bike, it's pretty extraordinary, actually. So, what would Jill today say to 25-year-old Jill, knowing what you've been through? And how you came out of it?
You are stronger than you think, and you will overcome all obstacles, and you will outlast all adversity. Don't give up.
I think I knew that then.
I did. I was just going to say, I think I knew that, but you know, I think the other thing that's so profound and so important for people to hear is, I think sometimes our worthiness, I mentioned work and workaholic, comes from achievement. I still struggle with this, but I think trying to find worthiness in who we are at the core and not what we do. And like I said, I still struggle with this, but for sure the 25-year-old Jill felt like she had to prove something to somebody, and that's not okay. And that's too much pressure for any one person to bear. So as we start to own ourselves and know that we are enough, regardless of what we achieve or accomplish, that's so healing. So we don't have to continue to strive to be more and do more and never be enough.
So where do you see yourself, and what do you see yourself doing, and what do you hope to accomplish in the next 20 years?
Yeah. So I have such a if you can't tell, I have a burning passion to change the world. And it's not about ego. It's about truly, truly loving people and creating a place for healing. And the things I see in the future, I love to teach. It's funny because I'm actually an introvert. I love to study and read by myself. But when I get in front of people and I'm sharing the passion and the teaching, I get so excited. I get so pumped up because I see the lights going in their eyes, and I see the permission to go step out and do their thing. And I hear the stories where they come back and they've done it. And then I want to write. I want to write so that I can impact more people than I can see in my clinical practice. So expect a book coming out probably next year.
How exciting.
Yes. And so continuing teaching, writing, and I really want to continue to train physicians not only in the aspect of education and lectures, but in the clinic, maybe mentoring. So I would love to see that happen as well.
Best of luck to you, and
Thank
thank
you
you so much for being so open and humble.
You're welcome. Thank you. Thank you for having me.